Numbers are in. The Centers for Disease Control today say the chance a child will be diagnosed with autism or a related disorder is now 1 child in 88 in this country, up from 1 child in 110. Autism Speaks co-founders Bob and Suzanne Wright join us tonight. Mr. Wright, the former chairman of NBC Universal. You have 6 lovely grandchildren. Your first grandchild, your grandson, is autistic. Co-founders of Autism Speaks. Speak to the numbers, first of all, especially at a time when autism funding seems to be under increased pressure.
Well said. The number is 1 in 88, which includes boys and girls. But it's more severe with boys, so it's 1 in 54. 1 in 54 boys. This is really without precedent. It's gone up 78%. The CDC's numbers have gone up 78% in the last 10 years. It's probably 50% better diagnosis. And the rest of the 50% is really unknown, and it can be ascribed to a lot of things and issues which we can't deal with. I would say the same thing is true with many cancers and other conditions, so it's not unique in that regard.
Let me talk to you as somebody, you've been so relentless in your passionate pursuit of funding here. Talk about that concerns, and I want to talk to, I understand you had a chance to meet with CDC today. Talk, Ms. Wright, about the concerns you have about where we stand with the prevalence increase, the worry about funding decreases.
Well, this is a national public health crisis, and we all have to be part of the solution. 1 child every 12 minutes is now going to be diagnosed with autism. 67,000 children a year, 61% will be boys. It is just absolutely amazing that we don't have as a country a national agenda, the way we addressed AIDS, the way we address diabetes, the way we address breast cancer. This is our generation of children that is being taken away by autism.
And finally, a brief thought, sir, we're going to be at a major event tonight kicking off Autism Awareness Month. That'll be here in Palm Beach County. We'll have full coverage. A final thought, you met with CDC today.
Well, we pointed out to a number of people that we finished a very extensive, much more extensive review in Seoul, Korea, sponsored by ourselves and a whole series of academics from all over the world. And that number turns out to be 1 in 38, which is closer to the real reality because they brought more medical in. So people shouldn't think that the 1 in 88 is terrible enough. But if you really want to go to the gold standard of the way you do this, it's closer to 1 in 38. That's where we're going to end up here in the United States at some point.
And speaks to the need for the funding fight you're leading.
You know, the CDC only has $21 million set aside for autism out of $11.5 billion budget. And that 21 is now at risk of being taken away either in part or in whole. So, I mean, it couldn't come at a worse time, and it's not even nearly enough. So we are in a fight for ourselves.
We're taking a grassroots
revolution. We need a major campaign. We have to organize ourselves, and we're going to work heavily with the Health and Human Services Agency. They're the ones that actually control all of this. We have to work out a much better plan than the one we have.
Bob and Suzanne Wright, I know it is a tireless, passionate fight for you. We'll be at the major kickoff event tonight. Thank you for giving our viewers a few moments and your perspective. We appreciate it.
Thank you very much for having us.
Our pleasure. Shannon?
Michael.